Hello, I am Dr. Shalini Gupta, the Dermatology Laser and Vein Center. Hope everyone is doing great. And today I thought we'll talk about PRP, which stands for Platelet Rich Plasma. And this has become a very popular procedure. It has been used in other disciplines of medicine as well. For example, most commonly in the orthopedic field, for joint issues, for ligament repairs, and tendon repairs. But in the aesthetic field, it has also become quite an important tool, especially for hair regrowth. And we are seeing actually some really quite nice results with using PRP, platelet rich plasma, which is injected into areas of hair loss to help those hair follicles regenerate and start growing regrowth of hair. So, alopecia is a term that means hair loss, and there can be different causes for alopecia. The most common one that we see amongst men and women is androgenetic alopecia, which is genetic alopecia. And this tends to occur in men starting at any age really, depending upon their genetics. And the first signs are usually a receding hairline, and you'll see hair loss especially in the temples and then in the crown of the scalp, and then those two areas start kind of coming closer to each other and fusing, and then ultimately you lose all the hair on the crown. And in women tends to begin also in a similar fashion, although women tend to see a little less temporal hair loss and more of the hair loss beginning in the crown. You can also get alopecia just from using the wrong types of products in your hair that can cause an irritation to the hair follicle, damage to the hairs, and you can start losing hair that way. You can also have an autoimmune type of alopecia, which is called alopecia areata, and with that you will usually see very defined patches of hair loss. So if you see a really defined patch of hair loss that just looks like somebody took a cookie cutter and cut out a bunch of hair from one area, that's usually alopecia areata, and that is usually your own immune system attacking your hair follicles. Then you can also have telogen effluvium, and that's just a fancy word for any hair loss that is related to stress. So it could be post-pregnancy, a lot of women tend to lose hair. It could be just after a stressful event or an illness. Perhaps you had an illness a few months ago, and then 2 to 3 months later, that hair stops growing, and then you have to wait for a new cycle, a new crop of hair to come. So the PRP procedure is actually helpful for all of those different types of hair losses, including the autoimmune hair loss, which is quite interesting. The only requirement for the PRP to work in a hair loss situation is that the scalp should not be scarred. So there should not be any scarring to the hair follicles themselves. Otherwise, it's difficult to revive those hair follicles. And there can be some scarring alopecias that are related to an inflammatory process or possibly from an infection. So those types of situations and scalp problems would not probably respond as well to PRP. So usually we have about 200,000 platelets per ml of blood that's circulating in our whole blood. So the first thing we do is we draw your blood into a tube, sort of like this. These are specialized tubes that contain a medication in it that helps to separate the red blood cells from the rest of the plasma. So then once the blood is collected, we get it out through a simple little pinprick through usually your arm or some vein that is nice and prominent. Draw that into a tube. The tube gets spun, and once it is spun and the red blood cells have separated, then it is re-injected into the areas of hair loss. And we're trying to usually keep that concentration of platelets to somewhere between 1 million to 2 million platelets per ml. So if it's too less of a concentration, it may not work very well. And if it's too high of a concentration, it may not work too well either. So there are some indications where a higher concentration of platelets may be desirable, and in some situations where a lower number of platelets might be desirable. For example, usually with tendon injuries and such, a lower platelet concentration is more ideal. But for hair, it seems like about 1.5 million platelets per ml of blood is the desired concentration amount. And although we cannot measure that, the systems that we have chosen should be producing about that concentration for us. More is not always better, especially when it comes to PRP, but having the exact right ballpark of dosage is important. So once that blood is collected, like I said, then we inject that throughout the scalp. And so what is in the PRP? There are, of course, a concentration of platelets. And why are platelets helpful? Well, so platelets make a host of different growth factors. And one of them is a vascular endothelial growth factor. It also produces platelet-derived growth factor, transforming growth factor beta, epidermal growth factor, and insulin-like growth factor. The insulin-like growth factor especially helps to induce and it prolongs the anagen phase of hair growth. So anagen phase refers to the growth phase of the hair cycle. So it prolongs that growth phase of the hair cycle, which allows for the hairs to grow longer. There are also proteins in the PRP and dense granules which contain factors like serotonin, histamine, dopamine, calcium, and adenosine. And these help to increase cell membrane permeability, and they help to reduce inflammation. And in that regard, they help the hairs to regrow, to revive. So let me show you really quickly what the actual PRP looks like once we spin it in the centrifuge. And this is a picture showing the red blood cells which are concentrated on the bottom. There is a separating membrane that forms, and then the PRP is right above that. And this gets drawn then into a syringe, and then it gets injected throughout the scalp. And this is a little video showing me injecting the PRP into the scalp with a very small needle. It's a 30 gauge needle. It is a little bit of a painful procedure. We can ice the area before doing the PRP, that helps, or sometimes you blow cold air on the skin, that can also be helpful. But whatever it is, make sure you're not taking any anti-inflammatory medications before you come in for this procedure, especially for 2 weeks in advance. You don't want to take any type of ibuprofen that would, or aspirin that would affect your platelet counts or your function of the platelets, and then also potentially cause more bruising for you as well. So, but that's how it works. That's how it's done. And here's an example of a female patient. This is before treatment, and this is after her first set of treatments. You can see a nice closing of that gap where she was experiencing hair loss. And then this is before. This is actually the same patient. And then this is after her next treatment. So you can see how nicely the hairs have repopulated the area. This is another patient. You can see a lot of her scalp through her sparse hairs. You can almost count all the different moles on the scalp. And here she is after just one treatment with the PRP. So that's pretty impressive to go from here, where it's almost transparent, you can see through the hairs, to a much denser hair count, and now you can't see her freckles as much on the scalp. Here's another patient before. You can see a partition, a fairly wide partition of hair, and then bridging that gap nicely. This is a male patient. Again, you'll notice here he is losing hair, but there are miniaturized hair follicles which can be revived with the PRP. If one has completely lost their hair and there are no more miniaturized follicles left, then this may not work very well. So the sooner you start, when you begin noticing this problem, the better it is. So here's another example of hair regrowth. A nice dramatic improvement. So we recommend doing this procedure once every month, and that is the process that we feel works best. And after you do it for 3 months in a row, once a month, we recommend that you come in every 3 months for the first year. After that, probably every 2 to 4 treatments a year for maintenance, depending upon your situation, is best. Now, you can also do some adjunctive treatments with the PRP to help you get the best results. And one of them would be to use vitamins. And there are different vitamins that are quite helpful. We like to recommend one called Viviscal Professional. It's a well-regarded supplement for hair regrowth, and it contains primarily B-complex vitamins. Biotin is also very important. Usually we recommend taking 5,000 micrograms of biotin for healthy hair and nails. It also contains iron. It also contains basically like a marine complex that is proprietary, and also horsetail extract, which is rich in silica, and that helps to make the hair stronger. And it also contains vitamin C. We also recommend that you take, that you're not iron deficient, that you're taking a good amount of protein and vitamin D. All of these help your hair. Now, some vitamins can have a negative effect. So if you have too much iron in your system or too much vitamin A, it can actually cause hair loss. So you always want to be in the right balance. You can also take Propecia orally if you're a man to help prevent further hair loss. That is something once you begin, you pretty much have to take indefinitely. And it's fairly safe, and a lot of patients do take that. I also recommend you can use minoxidil, and that is available for both men and for women as well. And you can apply that topically to your scalp. I also recommend the use of the Theradome light system, which is a helmet. And you can wear this. We usually recommend about 3 times a week, 30 minutes, very easy to do. You can go about your chores while you have the helmet on. And it is a very strong red LED laser light that helps to reduce inflammation. It helps improve vascularity and helps your hairs grow. And that is something you can continue to do indefinitely at home on your own. It sure beats those combs where you have to comb through your hair constantly. This you just put on your scalp, go about your day for 30 minutes, and you're done. So that is PRP in a nutshell for hair growth. Now, we also use PRP for a few other indications here in our office. One is as a potential filler by itself or in adjunct with other fillers. So it helps to volumize areas in the face more naturally, especially if someone does not want to have filler and they want something more natural. We can inject PRP. I really love it, for example, for the tear trough area under the eyes, and other areas of the face as well. And over time, it will help strengthen the skin. It'll help make new collagen fibers and elastic fibers. So it's a great option for as an adjunct to fillers or as an independent filler on its own. We can also use PRP topically on the skin, usually in combination with microneedling or post any laser procedure where there is some compromise to the skin, where it will allow that PRP to penetrate through the skin. And again, it is going to actually help with the healing, but also give you better results from the skin rejuvenation procedures like microneedling and other laser treatments. So in our practice, we also use the PRP in men and women in the genital area, known as either a P shot for men or a G shot for women. And for men, what the P shot accomplishes is when we inject it around the base of the penis, it helps with better erection and a longer lasting erection. In women, the G shot can be injected around the clitoris area, again for increased pleasure, and it can also be injected more into and around the vaginal canal to help with lubrication and again just improving the overall tissue of the vaginal canal so that you have better lubrication and more pleasure. So these are all the indications that we're currently using PRP for. There may be more in the future. It is a natural product. Patients like that. It is your own blood. We spin it and then we re-inject it into areas where it is going to be of use. So I hope this was informational and you have a wonderful day.